Where a suspected cholera outbreak in Opuwo has raised concern. Now, to help the public understand the situation and the ministry's response, we speak now to the Executive Director of the Ministry of Health and Social Services, Mr. Penda Ithindi. Sir, good evening and welcome to the Daily Roundup.
Thank you. Good evening, Nina. Thank you for having me, and thank you for this opportunity. Penda Ithindi, actually.
Penda Ithindi. Thank you so much. We appreciate your time tonight. Just to start with, can you give us an overview of the current cholera outbreak in Opuwo?
Yeah, thank you very much. Indeed, it's not an outbreak yet. It's suspected outbreak. As you recall, and the public may recall, we have, as a ministry, last Friday, issued a public notice, public announcement, to indicate to the public that we are dealing with a suspect and a potential cholera outbreak in Opuwo district of Kunene Region. We started off with 2 cases of suspected cholera outbreak. It involves 2 young children, aged 4 years old, from the same household. Since then, we are talking of 8 suspected cases, 08. So out of the 8 cases, 6 are from the same household. And we are therefore, as we discuss and update the public, we'll also talk about the aspects surrounding the household of interest, where the 6 cases are from. Unfortunately, as we have updated last Friday, one of the 2 first cases has demised upon being admitted at our Opuwo District Hospital, mainly because of the timeliness and health-seeking behavior by the time the child was brought to the hospital. So we are dealing with 8 cases. The 6 cases are in the isolation ward of the Opuwo District Hospital. They are in stable condition. They are receiving treatment, and we are hopeful that they would progress to recover.
Well, even though 8 doesn't constitute as an outbreak, as you rightfully said, it is a concern and raises, you know, concern because it's 8 cases of cholera outbreaks, which is not the norm. So do we have any information in terms of the similarities? Do these individuals come from the same areas and what the causes, etc., behind this war?
Right. As I have indicated, so 6 of the 8 cases, they come from the same household. So we started with the 2 from the same house. They increased to 4, and now we have 6 from the same household. And therefore, the matters around hygiene, around the support that is needed at that household level, and our teams are dealing with the matters. The other 2 cases are from the margins, villages and settlements around Opuwo. Yes, you are right. We are not treating it lightly. The number has clocked up from 5 to 8, as we are talking about. And I just want to also inform the public of what we mean by suspected cases vis-a-vis the outbreak. According to the definition, international definition, as per the World Health Organization. So you have to do the necessary tests in order to arrive at a conclusion that you have a cholera case. So what happens is that we do initial tests, what we call culture tests, to basically establish if there is presence of a cholera bacteria from the individual that is affected. So that is what we have done for all the 8 cases. These tests, these culture tests, these initial tests are done locally by our Institute of Pathology, NIP. But so from that type of tests, then we have picked up that, yes, all the tests point to signs of cholera bacteria. But one has to do additional tests, basically the PCR test, to be able to identify what type of strain of cholera bacteria that we are dealing with. Those tests, we cooperate with South Africa. We send them to a laboratory in South Africa to be able to get that confirmatory test. We have not yet received a confirmatory test result from our sister institution in South Africa in that regard, and only then, when you have a confirmatory test, that you are able to say then that this is a cholera case. And when you do so, depending, of course, on the strain of the bacteria that you are talking about, then one would say this is an outbreak or not an outbreak. By international definition, when you have one confirmed case, it's an outbreak. So at the moment we are treating them as suspected cases, but from the ministry point of view, it is all systems go. So we are not taking it lightly. We treat it as we have consistent results from the culture tests that we have done nationally, that we are dealing potential cholera outbreak. And therefore, we have mobilized all the measures that we can take from the prevention point of view, from the detection point of view, and from the public health point of view, and the capacity of our district hospital to be dealing with those cases.
Ms. Ithindi, we appreciate that thorough explanation and then the feedback that you've given us this evening. Thank you so much for your time.
Thank you so much. Thank you for having us, and we'll be able to come back again to update the nation and the public as this situation develops. Thank you.
That was Mr. Penda Ithindi, the ED from the Ministry of Health, speaking to us. It also wraps up this evening's edition of the Daily Roundup. I just want to alert all our viewers that the 23rd Theo Ben Gurira lecture series will be live streamed. You can catch it on NBC2. From us, until tomorrow, it's good night and thank you for watching.